This conference will now be recorded.
Good morning, everyone. Thanks for joining us for today's virtual press conference. For those on the call that are not familiar with the Pennsylvania Healthcare Association, we are a statewide advocacy organization for Pennsylvania's most vulnerable residents and their providers of care. Our members consist of skilled nursing facilities, personal care homes, and assisted living residences. Collectively, we represent more than 500 long-term care and senior service providers and more than 50,000 elderly and disabled individuals. As we have now reached the one-year mark of the COVID-19 pandemic, we wanted to create this media availability to reflect on the past year and address the current state of long-term care. On today's call, we have PHCA President and CEO Zach Schamberg to provide a Pennsylvania perspective. To offer a national perspective, Zach is joined by Mark Parkinson, CEO and President of the American Healthcare Association and the National Association of Assisted Living, representing more than 14,000 nonprofit proprietary skilled nursing centers, assisted living communities, subacute centers, and homes for individuals with intellectual and development disabilities. Before we begin, just a few housekeeping notes. This press conference is being recorded, as you heard, and will be shared following this call with the press release that goes out following the event. As a reminder, please set your GoToMeeting view option to view who's talking. At the conclusion of today's remarks, there will be an opportunity to ask questions. We will do our best to answer all questions within the scheduled time, as we want to be mindful of Zach and Mark's schedules. If we do not get to your questions, we will follow up with answers following this call. To ask questions, please use the chat feature within GoToMeeting to let us know you have questions. We already have received a few of them and in advance, and we will start with those first. Again, thank you for joining us. I'll turn it over to Zach Schamberg, President and CEO of Pennsylvania Healthcare Association.
Thanks, Eric, and thank you all for joining us today. And I am very honored to be joined by Mark Parkinson, the President and CEO of AHCA NCAL. Mark has been a terrific advocate and a terrific champion for long-term care providers, for frontline workers, and most importantly, the residents that they serve, not just here in Pennsylvania, but throughout the entire country. Let me start today by saying this. On March 11th, 2020, life as we knew it changed forever. The World Health Organization declared COVID-19 a global pandemic. And in the weeks that followed, schools closed, businesses were forced to shut down, and millions of hardworking people lost their jobs throughout the country. But by March 11th, 2020, long-term care facilities throughout Pennsylvania, including nursing homes, personal care homes, and assisted living communities, were already preparing for a new world and a dramatically different operating environment. It was only 2 weeks prior that the first confirmed case of COVID-19 in the United States was discovered in a nursing home in Washington state. And it was made clear then, and it remains clear today, that long-term care would be the absolute epicenter of the COVID-19 pandemic. I can remember an early morning telephone conversation with my counterpart in Washington state in March 2020. I was calling that morning because on behalf of the providers who we represent, I wanted to learn, how should we prepare here in Pennsylvania? What will we need? And was this virus as terrifying as all the news reports around the world were telling us? And what we learned that morning, more than a year ago, remains a focal point of our advocacy today. And that's that long-term care must be prioritized. Because the search for PPE or personal protective equipment intensified, long-term care should have been moved to the front of the line. And as testing was developed and limited supplies were being distributed, long-term care should have been the first to receive them. As hardworking frontline staff began to leave to keep their families safe, or they contracted the virus themselves, and staff from other healthcare specialties became available, long-term care should have been the first place they looked to find work. And even today, as the vaccine gradually makes its way through Pennsylvania, and every industry and every segment of our population believes that its members should be the first to receive it, long-term care should be the primary target. Again, as this pandemic has taken hold of our world and every issue and every lockdown is debated through a political lens, one thing remains certain. We must prioritize our vulnerable seniors and our healthcare heroes in long-term care. It's also worth looking back today before the pandemic began. For the better part of the last decade, advocates, including PHCA and AHCA NCAL, have warned about the long-standing challenges that impact nursing homes and long-term care providers, such as inadequate reimbursement rates from an underfunded Medicaid system, a workforce crisis that has crippled our ability to recruit and retain staff, a legal system rife with frivolous lawsuits from out-of-state attorneys, and a regulatory environment that is second only to nuclear power in oversight. The COVID-19 pandemic exacerbated and amplified those challenges. It exposed the dire need for support, and it reinforced the need for prioritization. Now, even in the midst of these challenges, the men and women on the front lines of long-term care have truly lived up to their newfound title, and that's healthcare heroes. In the face of adversity, even as case counts skyrocketed and supplies were nowhere to be found, I'm proud to say our staff never lost sight of their goal, keeping their residents safe. Now, today is certainly about looking back on the past 12 months, but as we approach March 11th, 2021, we think it's even more important and even more vital for the future of long-term care to look forward. Mark will speak to you today about some of the encouraging numbers that he's seen at a national level, as well as what some other states are doing to safeguard a sustained long-term care system. But here in Pennsylvania, we need a long-term investment in long-term care. The state's Medicaid system, which pays for more than 2/3 of all care provided in our 700 nursing homes, has been underfunded since 2014. We have to do better. Medicaid drives every investment our providers make, from being able to retain and recruit staff to investing in care and our residents themselves. And we need to think outside of the box when it comes to our workforce crisis. We were proud to work with AHCA NCAL last year to implement the temporary nurse aid training program, which was a way to recruit thousands of Pennsylvanians to long-term care, even at a time when no one else was hiring. And we were grateful to our legislature, including the prime sponsor, State Senator Judy Ward, as well as Governor Wolf, for enacting legislation that puts those temporary nurse aides on a path to full-time employment as CNAs. More initiatives like that are imperative moving forward. Finally, just as I spoke about priority, I want to stress the importance of collaboration. Since March 11th, 2020, long-term care providers in Pennsylvania have been fighting for inclusion, a seat at the table. Our frontline experts are willing to share their experiences, their challenges, and perhaps most important, their solutions. As we say during almost every legislative hearing, long-term care must be at the table when decisions surrounding our industry are being made, because collaboration and cooperation, not obstacles and obstruction, will lead to better outcomes. A few days ago, Mark appeared on CNN and he shared some really encouraging news regarding the drop in COVID cases in nursing homes. And I hope he'll share that with you today. While we're also encouraged by those numbers, we have to caution our elected officials, because this is not over for long-term care providers. It's not over for staff, and it's not over for our residents. Issues do remain. We need a plan to safely reopen our facility. We need a plan to continue vaccinating our residents and staff. And we need to ensure that our workers and our residents have the support that they need and deserve moving forward. I want to thank you all again for joining us today, and I'm very honored to turn it over now to Mark Parkinson.
Hey, Zach, thank you very much for the kind introduction. And it's my pleasure to be here today with you for certain, and all the folks from the media. We greatly appreciate your interest in letting us talk about what's happened over the last year and what needs to happen over the next year or so to really make sure that we can pull out of this thing. You know, I agree with all of the comments that Zach made. And when I look back on the last year, there's no question that it has been the worst crisis in the history of the long-term care sector. You know, we prepare for all sorts of scenarios. You know, people always say you got to prepare for worst case scenarios, and we thought that we had done that. But COVID has proven to be much worse than what we thought was the worst case scenario. When you look at the statistics, it's sobering. In all of long-term care across the country, over 170,000 people have died. It's an astonishing number. And behind each one of those statistics, there's a family, there's a loved one, there's a grandparent, spouse, and each loss of each one of those people is tragic. And we mourn and give our condolences to all of those folks. There are a couple thousand of the healthcare heroes that Zach have talked about that have died as well. Frontline long-term care support staff that courageously have gone into facilities to work with residents and take care of residents, and unfortunately they have died as well. It is a tragedy of unthinkable proportions. You know, when my wife and I had our buildings, you could pretty much plan for your residents' deaths. There were surprise deaths, but they didn't occur that often. And yet, in the period of just 12 months, over 170,000 people have died. We haven't been able to prepare them and their families for the deaths. We haven't been able to get loved ones around them as they spend their last moments here, and it has really, really been tough. You ask yourself, how in the heck did this happen? And the truth is that it's really not anybody's fault. COVID is a virus unlike any virus that we faced before in one very important aspect. All of the other viruses that we fought have been symptom-based. And as a result, our infection control policies coming into COVID were symptom-based. All of these buildings had infection control processes, and all of them practiced them and worked on them before this, but they didn't work here. And that is because perfect infection control didn't require that we wear a mask every single time that we would move a resident from their bed into a wheelchair, or every time that we would dress them and physically touch them to dress them, or every time that we would transfer them in the restroom, or every time that we would hug them or sit down and have lunch with them. And the reason that's important is because what we learned a couple of months into this is that COVID was spreading by asymptomatic people. What we were doing with our infection control was we were taking staff's temperature. If they didn't feel well, we were sending them home, and same with the residents. But that wasn't working because this virus was very silently and in a very stealth way spreading throughout buildings across the country. Once we learned that, there were then some policy mistakes that were made. We were not made a priority. Our residents were not made a priority. There were very limited amounts of tests available, and they weren't coming to long-term care. There was a limited supply of PPE available, and it wasn't coming to long-term care. Everything instead was going to outside folks and not to the residents in these buildings that desperately needed it. And the consequences speak for themselves. Thousands, possibly tens of thousands of people died that did not need to die because of the lack of adequate PPE and testing. Since we've learned what a tragedy it has been to not make long-term care residents a priority, the government has now started to do it. And we've seen the very positive results of them doing that. Starting in the middle part of last year, both at the federal and state level, we started to see some assistance to facilities so that they could provide the PPE and the testing that the residents needed. And then most important was the decision that was made at the end of 2020 to put residents of long-term care facilities at the absolute highest priority level for the vaccine. And the good news is that when we place the elderly at a high priority, it works. Look, in fact, what's happened with the vaccine. We have seen a dramatic reduction in new COVID cases in buildings, and more important, a dramatic reduction in deaths in the facilities as a result of COVID. At the peak of COVID in long-term care facilities across the country, specifically just nursing homes, there were over 30,000 new cases a week. When we look at the most recent available data, that number has plummeted all the way down to 3,000 cases a week, almost a 90% drop in new COVID cases. And most important, deaths have also plummeted over 70%. And we anticipate that because death is a declining indicator, it occurs after we begin to see a decline in overall cases. We think that we'll see a continued drop in the overall death rate, perhaps getting as close as possible to zero in the not too distant future. This has occurred because we have finally done what we should have done in the first place, which is that we made the elderly and long-term care facilities an absolute priority. So what is the lesson? Well, the lesson is that moving forward, as Zach indicated, we've got to continue to keep the elderly and the healthcare heroes that work on their behalf at the absolute priority. First, in terms of the vaccine, we cannot take our foot off the pedal. We've got to continue to make vaccine available for new residents and new employees of these facilities. It's going to be completely necessary for the next 6 to 9 months. Secondly, in terms of support, although the clinical nightmare in long-term care facilities is ending, the businesses themselves are in shambles. Hundreds, perhaps thousands of long-term care facilities are at risk of going under if they don't receive additional state and federal support. And ultimately that hurts the residents the most because the optimum care simply can't be provided to them if the resources aren't available. And the third thing that we need to make sure is that we need to make sure that the litigation be kept in perspective. As Zach indicated, oftentimes there are frivolous lawsuits brought by out-of-state attorneys, and we're starting to see that across the country. The problem with COVID is that there are many aspects of COVID that were just simply unpreventable. The fact that it spread through asymptomatic carriers made it impossible for us to stop, and that's become evident by the fact that the CDC believes that as much as 1/3 of the population in general has already been inflicted with COVID. The very best providers implementing the very best infection control have been unable to stop this. It now makes absolutely no sense for these buildings to be faced with scores of lawsuits that would potentially impact their ability to provide quality care moving forward when the virus itself was so impossible to stop. So we would strongly encourage the state to continue the funding that is provided and to look at some sort of liability protection to make sure that we don't undo the financial support that we provide these buildings. And finally, again, let me just acknowledge the healthcare workers. They've done an amazing job. There are parts of the country where parts of the world, where when COVID would hit buildings, the workers would flee the buildings. That did not happen in the United States. Our infrastructure held together. The workers, instead of running away from the buildings, often wanted to stay. They didn't want to be quarantined. They wanted to work extra shifts. And as a result, we've been able to hold it together. So my hat is off to all of the folks in Pennsylvania that have continued through very difficult circumstances to work on behalf of the residents in these facilities. Thank you, Zach.
Thanks, Mark.
Thank you, Mark. Thank you, Zach. We'll go to our questions. And again, the chat box is open. If you'd like to submit a question, we did receive a couple in advance. We're going to start with those first. Lisa Scheid from the Writing Eagle shares, what policy issues for long-term care did COVID show us?
Yeah, Lisa, let me start there, and Mark, please feel free to jump in. I outlined a few of the policy issues during my remarks. First is we need to invest in our state's Medicaid system at the federal level. We need to invest in Medicare to ensure that long-term care providers are supported and that they in turn can invest in the care they provide, as well as invest in their staff, in their buildings, in technology moving forward. We need to bring innovative solutions to our workforce crisis, like the temporary nurse aid program. So we really need to take a renewed focus on some of the workforce shortage and workforce crisis issues. We need to look at the state's legal system and really nationally the legal system as it relates to long-term care. And we need to look at regulatory oversight. And I spoke about a collaborative agreement or working together with the Department of Health, the Department of Human Services, and those who regulate us, because I think that is going to yield a better product moving forward. I also would just mention what Mark had mentioned, and that's that the prioritization of long-term care, when it didn't happen, it led to executive orders where PPE was taken away. We saw the prioritization of hospitals in other guidance that was issued. Those were policy decisions that really had a long-lasting impact and effect on our most vulnerable. So we need to ensure that long-term care is prioritized moving forward. Mark, go ahead.
Yeah, I would echo some of Zach's comments. First, I think that the pandemic really demonstrated the chronic underfunding on the Medicaid side. We came into the pandemic with some buildings just not prepared financially to fight this. And so the chronic underfunding that we talked about, unfortunately, has come to fruition in a very negative way. Second, I've already talked a lot about it, the prioritization of people that live in buildings. These are our folks that really established the country, made us what we are. We need to make them a priority. And when we did it with the vaccine, the results speak for themselves. When we didn't do it early in the pandemic, the tragic results there are obvious as well. And then finally, I'd add a third thing. And the third thing I would add is, let's somehow try to make sure that public health is not politicized in the future. There's no reason why a pandemic should have developed into a political fight between red states and blue states and liberal people and conservative people. The virus doesn't really care. So we just need to somehow depoliticize public health, because I think that the politicalization of COVID has had tragic consequences.
Thank you. Lisa also asked, and Zach, maybe you want to take this one, how will Pennsylvania's experience of COVID shape attitudes and care for seniors in the future?
Well, I hope it's changed the attitude that we have here in Pennsylvania as it relates to long-term care. We're talking about support. We're talking about prioritization. You know, one of the things that this pandemic has done is really put long-term care in the spotlight. It's given providers, workers, and residents a bullhorn, a microphone that I don't think they've ever had before to talk about some of these existing challenges and some of the challenges that have emerged just in the past 12 months. So when we're talking about attitudes as it relates to our seniors in long-term care, I hope that we fundamentally change our focus here in Pennsylvania and ensure that those seniors, our aging population, receives the support that they deserve. You know, we're the third oldest state in terms of our population in the entire country. Our fastest growing demographic is age 85 and older. And we are about 3 years away from the silver tsunami. And that's when the baby boomers will age into the demographic most in need of long-term care. We need to ensure that this is a sustainable system moving forward. And if we don't do that, and if we don't invest, I do fear that we will not be able to care for our population moving forward.
Thank you. Mark and Zach, Flora Pastor with penwatch.org asks, what is the current situation with family relatives being able to visit residents in nursing homes? And when will visitation be allowed to occur?
Mark, do you want to take that from a national perspective?
Yeah, I'll take it from a national perspective because it's largely controlled by CMS. And so there are some things that Pennsylvania can do, but it's really being dictated by what happens at the federal level. At the federal level, CMS has been quite conservative in terms of letting outside folks into buildings for all the obvious reasons. COVID spreads very quickly, and as I just talked about, it spreads through asymptomatic carriers, and there really hasn't been a way to keep it out of buildings if the buildings are opened up. And so we have supported the position that CMS has taken. Now, however, now that we know that the vaccine works as well as it does, and cases are plummeting in buildings, we really think it's time for the federal government to consider reopening buildings. And we believe that there will be an announcement, perhaps as early as today at the federal level, that will indicate that folks that are fully vaccinated can come into building and visit residents who are fully vaccinated. We think that's a really good first step in terms of opening up buildings. As we see further spread of the vaccines in the general population, and as the folks in the buildings that have received their second dose and they're able to produce their own antibodies, we think the government should consider going even further with that. And there's a very low amount of COVID in the community. We're hopeful that the federal government will then reopen up the buildings to visitors. The lack of visitors has been really, really challenging for residents. Oftentimes, the visitors are family members that are an important part of the care plan and support for the residents. So it is really important. We don't want it to happen before it's safe. We think we're getting to a point now where it's safe, and we're hopeful that visitation will start up very soon.
Yeah. And I would just add, first of all, I think that's great news if we're able to hear that CMS announcement today. It's the number one question surrounding visitation. It's the number one question that we receive not only from members of the legislature here in Harrisburg, because they're certainly hearing it from their constituents, but for the first time that I can recall, the Pennsylvania Healthcare Association is being inundated with emails and phone calls from the family members and relatives of our residents in our member facilities. And they're asking those questions. When can I see my loved one? If we're both vaccinated, what does that mean for us? So we do believe that updated guidance is necessary, that the sooner the better, so that providers can begin to prepare for that. And hopefully we'll hear that announcement soon.
And it's just another reason, Zach, why it's important for members in the community to get the vaccine when it's their turn. When it's their turn to get the vaccine, they need to do it, because that's really going to impact their ability to come in and visit their loved ones in our buildings.
Laura also asks, what impact has this lack of contact had on residents?
Yeah, I think there's, Flora, not only a mental toll, but a physical toll as well. I'm going to tell you about this from two perspectives. One is my own. I've spoken with many of the reporters who are on the call, and Mark knows as well that my grandfather is in a personal care home. He has dementia, and for the last year, we've only been able to see him through a window visit. And that has been very, very tough for my family. But more importantly, it's been very, very tough for him. Last week, we held a roundtable to mark the 1-year milestone of the World Health Organization's announcement. And we brought in another family member of a resident. And to hear her talk about the importance of the compassionate care visits and just being able to hug or touch her mom, it really brought home the idea of how important reopening to visitation is going to be. Again, not just from a mental standpoint, but from a physical standpoint for all of our residents. Mark, did you want to add anything?
Zach, you really said it in a very touching and important way. And there will be people that will actually quantify it. There'll be folks that'll go back and do retrospective studies. And I think that we'll see that there's been weight loss and that there's been depression, and there just hasn't been the clinical improvement that you would hope with many of the residents. It's been very, very hard on them. And one of the exciting things about the vaccine working so well is I think we're right now on the precipice of being able to reopen the buildings. And it's just everything to these residents. Many of them are, without their spouses, without other important loved ones, and really rely upon these visits as for giving them purpose in life. And so hopefully we'll be able to reopen very soon.
Thank you. I know we're approaching 11:30. We're going to try to get through the remaining questions that we have. Sean Hamill with the Pittsburgh Post-Gazette asks, and his question's about the vaccination rates. Given how difficult the deadly dealing with COVID-19 has been in long-term care facilities over the last year, are you surprised by the relatively low percentage, 50 to 60% of facility staff, and again, this is Pennsylvania numbers, who are taking the vaccine? What can and should be done to increase that percent?
Yeah, and let me start there. We have data that is saying that at about 58% of all our staff who have had the opportunity to take the vaccine in nursing homes are accepting and taking the vaccine in nursing homes. I was surprised by the relatively low percentage initially, but as I learned more and more about how employees and frontline workers are feeling and how they're getting their information, and really how they're dealing with a lot of misinformation, especially on Facebook and social media. Mark mentioned earlier about politicizing this virus and this pandemic. Unfortunately, that's been done, and one of the after effects of that are, a lack of trust, even amongst long-term care staff, as it relates to the vaccine. Sean asked what can be done to increase that percentage. We've tried to do everything we can, and I know AHCA NCAL has as well, in providing education and providing facts about the vaccine. We've really tried to empower our members on the front lines, our administrators, executive directors, directors of nursing, medical directors, to talk about the truth surrounding the vaccine and why it's so important for staff to be vaccinated. Mark?
Yeah, I would just say, first of all, the Pennsylvania rate is much higher than the national average. So as discouraging as 55, 58% is in Pennsylvania, that's actually quite good. The national average is 40%. So congratulations to the healthcare system, the public health folks, and most important, the providers that have been able to achieve that level. We're disappointed, particularly at the national number of 40%. We have now set as a goal to increase that to 75%. There are 3 other long-term care associations in DC. They have endorsed that goal. We are collectively doing everything we can to move the number up. We're working closely with the CDC to get a round of social media type blast out to employees of these facilities to really counter the false and negative information that exists in social media right now. That information hasn't really been countered. The government has been reluctant to run big ad campaigns encouraging people to take vaccine because there's a shortage of vaccine, and they didn't want to have a huge run on vaccine that didn't exist. But we're now going to be pushing back with what we think is really quality information for these staff members, addressing the concerns that they have, and hopefully getting the rates up. The encouraging thing about the new case numbers and the death rates is that it demonstrates that you can reach a level of herd immunity even if you don't have 100% of the people in the facility vaccinated. We've got about over 90% of the residents vaccinated. If we can get the staff numbers up into the 50, 60, 70% range, we will achieve herd immunity within the buildings.
And I just want to add, I'm really proud that Mark and AHCA NCAL have challenged providers and staff to meet that 75% goal. We've challenged our providers here in Pennsylvania to meet that goal, and I'm hopeful that we'll hit it in the coming months.
Thank you. Sorry for the feedback there. We had to mute some people. Staying with Sean, he asked, some states, including Pennsylvania, report COVID-19 cases and deaths by facility in long-term care. Do you think that as an aid to the public's understanding of how those facilities are dealing with COVID-19, that those states should also report the percentages of residents and staff by facility who are vaccinated for COVID-19?
Sean, it's a good question. I don't necessarily have an issue with it at this time. What I will tell you, and it's something that we've talked about since the beginning of the pandemic, I don't want to put another burdensome data input requirement on our frontline staff and these providers. If it can be done seamlessly and easily, I think it is important for the public to know about that, especially when they're looking at a potential nursing home, personal care home, assisted living community for their family member, as long as it can be done effortlessly and seamlessly, not with a new data source that is going to be required on a daily basis.
Yeah, I would echo Zach's comments. It's always better for providers to be transparent. So we encouraged our providers from day one of the pandemic, let the residents and the families know exactly what's going on in the buildings, so that they can, you can work with them, you can improve situations, you can get information out there. And then the government followed that up with the requirement, so now there is public data available. And we believe the same way on the vaccine. It is smart for providers to go out there and let their residents and their family members know exactly where they're at with the vaccine, particularly if they're getting to these high levels of herd immunity, to create a comfort level that it's safe within the building. So we are encouraging transparency.
Thank you. Our last question this time, and if there are no others, we'll wrap up after this, is from Paul Gove from the Pittsburgh Business Times. He asks, do you have a sense of how many Pennsylvania long-term care providers are financially challenged due to this, and what could happen?
Yeah, thanks for your question, Paul. You know, first I would say there was a recent study that was released by Mark and his team at AHCA NCAL, which we can certainly share. And what it talked about was the costs that have been undertaken or absorbed throughout the past year as it relates to the pandemic, coupled with historically underfunded Medicaid reimbursement rates in Pennsylvania, have really dramatically impacted our providers. And it could force providers to close their doors here in Pennsylvania. And we've seen it already in a few instances. We've also seen, Sean, a very volatile market. And I think Mark can speak to this from a national perspective as well. But tried and true family-owned Pennsylvania providers are getting out of long-term care. They're selling to other providers. In 2020 alone, our providers here in Pennsylvania are facing a nearly $5 billion loss. And that's because they were spending early last year during the summer, nearly $100 million on PPE, on testing, on hero and hazard pay for staff each and every week. So the COVID-19 pandemic costs coupled with the Medicaid reimbursement rates have really lended itself to a lot of uncertainty moving forward. And I would just reiterate the call for that investment from both a state and federal level moving forward. And Mark, I'll let you take that as well.
Yeah, there are 15,000 nursing homes in the country. 120 of them closed in 2020, but there would have been hundreds and possibly in the low thousands that would have closed if it hadn't been for the state and federal relief that was provided. There was a massive increase in expenses through PPE, testing, and equipment, and an enormous decrease in revenue because census declined dramatically. So we're at a situation where it's hard to definitively answer the question because it's a little bit artificial right now. The additional state and federal money kept these buildings going. And so what we really know now is that two things have to happen for the sector to prosper. One is there's going to have to be some continued funding at the state and federal level to keep those buildings going. And then secondly, ultimately, census is going to have to recover. The average building across the country has had a 13% decline in the number of residents that are in the buildings. And so a combination of both census recovery and additional state and federal aid is absolutely necessary, or else we're going to see hundreds of buildings, and I'm assuming some in Pennsylvania, that will close.
Mark, Zach, I want to thank you both for your time today. That concludes all the questions that we have. If there are any other additional questions that you'd like to have answered, please follow up after this event. We will close it out. We will follow up our event with a press release and a recording of this video so you have it at your disposal to use. Again, Mark and Zach, thank you again, and we appreciate all the media's attendance today. Thank you.
Thanks, everyone.